You have non-Hodgkin's lymphoma? Isn't that the good one? My friend had the same kind of cancer. Ooh, she died. And my personal favorite, you got cancer? My dog has it too. While we wince when we hear these comments, we know they are usually said by well-intentioned people. No one with cancer should bowl alone. Bowling Alone is a poignant book by Robert Putnam from Harvard, and his thesis is the very fabrics of our communities have frayed, and it's diminishing our lives and our communities. More Americans are bowling than ever before, but what was once a team sport is now a solitary outing. Cancer patients in our communities should not bowl alone. Objective 5 in the cancer plan calls us to connect patients and caregivers with the supportive services they need. The health system is taxed in providing medical care. Community-based programs ranging from legal and financial help, meals and nutrition services, exercise classes, and social support can lessen the burden on patients and caregivers. Cancer treatment and survivorship is tough. Community-based support programs are a complement to what health systems can offer. Often what a patient needs is someone who is not part of their medical team nor friends or family. Support and hope can come from many programs and many forms. There is immense value in community-based programs and their impacts on patients. One such idea is thoughtful peer mentoring that matches cancer patients on age, stage, and life experience. These criteria are critical to creating the personal connections that promote well-being and healing. I knew of many breast cancer patients, but it was especially important to see someone who was like me, my age and my diagnosis and what I'm doing in my life. It was like she threw me a lifeline. According to a new study in the journal Cancer, women with breast cancer who are socially isolated tend to have higher rates of recurrence and mortality. They are bowling alone. Connections can reduce depression and reduce isolation. Being diagnosed with stage 4 was overwhelming. When I found Firefly Sisterhood, I found a woman who was live like me 5 years from diagnosis, and she gave me hope in my deepest, darkest moments. We know that for every physical effect of cancer treatment, there is an equal psychological effect. And what we've learned about community-based peer mentoring is that it allows patients to have control over something. There is so little about appointments, treatment, and effects of therapies that you can control. When working with a peer mentor, the patient is in control of something, what they talk about, and when it happens. To be able to talk about the little things about treatment, unexplained feelings and emotions, with someone who'd walked that road, who'd been there, was huge for me. We have learned that it's important to provide the opportunity to explore and ask questions about challenging and very personal topics, such as intimacy, fears, family dynamics, and wigs, or the best post-surgery pillow. Guys, can you advance my slide? Thank you. Doctors tell you the facts, but don't always deal with the mundane things, like what type of bra to wear. Working with peer mentors supports patients' ability to advocate for themselves and to approach treatment with an improved frame of mind. When my patient came in after her meeting with 3 women about her treatment, she was confident in her decision and asked some really good questions. And these supportive connections and conversations also protect friend and family relationships. It can save a marriage. Taking that stress that I would normally put on my husband, I don't do that anymore. For health systems, confidentiality, HIPAA requirements, and capacity issues often get in the way of attempts to connect patients with each other. Community-based programs can solve this for clinics. Being able to connect with someone one-on-one who has been down a similar journey was so important for me. I connected with someone who had a diagnosis like mine, age 30, who had stage 3 and little children at home. Just to see someone in a similar situation, it was the first time I was able to breathe. When going through cancer treatment, patients should never bowl alone. It is time for community-based programs to create teams for cancer patients, survivors, and caregivers so that they never bowl alone.